Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of July 26, 2021. I am here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Alameda County has 94,796 COVID cases, and that is over 2,000 more than what I reported just last week, and 1,272 deaths. That is an increase of one since last week. In terms of vaccination, 83.8% of those who are 12 and up have received at least one dose, and 71.1 are fully vaccinated. And that is barely just about an increase of less than 1% since I last reported. And Oakland has increased even a little less than that and is now at 81% and 68% respectively. And you can see here that vaccination started off strong, and I think that they've leveled off a little sooner than perhaps we would have hoped, even though our vaccination rates here in Alameda County really are quite excellent. They are also quite uneven, and we still see pockets of Oakland, Hayward, and the unincorporated areas that have very low vaccination rates, while other areas have extremely high vaccination rates. And as you can see here, our cases continue to climb. And on the top there, you can see that the positivity rate is on a steep rise, looking much like many of our previous spikes. And you can see on the bottom graph, and remember that positives continue to be added to about the last 5 days or so. So it's already a steep climb upwards. And we see that that is even greater than I think what many had predicted would be the outcome of reopening on June 15th. This is just going up a little bit more steeply than I think any of us would have hoped. And what is also just as concerning, if not more concerning, is the commensurate increase in hospitalizations, where here you can see that we have 134 people with COVID-19 in the hospital, and that is up from 88 when I reported a week ago. So again, this is going up a little bit on a steeper climb than I think any of us would have hoped. And we know that part of this is due to the fact that we are now dealing with more contagious strains of COVID. The one on the left there is the original one that we were dealing with for the majority of the time, where one person could be expected to give it to 3 if we don't have measures put in place to prevent it. And with Delta, it is from 5 to 8. So looking like at least double the contagiousness in terms of the strains that we are now predominantly dealing with here. So this is where we're at. And as long as we have susceptible hosts, and of course the most susceptible hosts are those that are unvaccinated. We know that vaccinated people can still get it. We know that there's a failure rate of any vaccine. And with these, it is probably somewhere between 5 and 15%, depending on which vaccine, depending on which strain. But really that even when people who are vaccinated get it, they have a milder course and they are much less likely to transmit it. So the real susceptible hosts and the ones that are really helping the virus out right now in terms of places to replicate and places to spread are clearly the unvaccinated. And this is something that we know. Now, one of the things that we are hearing in terms of those who have not yet gotten vaccinated is this concern that the vaccine is part of a plan to commit genocide on Black people or people of color, or some kind of plan to thin the herd, so to speak, or a plan towards population control, or that the vaccine is some kind of tool for eugenics, which is it is the development of a race that is more desirable, or to weed out those the government finds undesirable. And so I have certainly heard an earful on all of these possible kind of similar versions on the same theme, which is that somehow the government is using this as a tool for some kind of evil purpose against particular populations of people. So I want to address this today, but first I want to start with how people of color are being impacted by COVID-19 itself. So I'm going to look just at Alameda County total death rate per 100,000 by race ethnicity. And you can see on the left there that the overall sort of average of everyone where we know their race taken together is 70.6 per 100,000, and you can see there that African American death rate is 130 per 100,000. So this is significant. It's not quite double, but it is very close. And Pacific Islanders just right behind at 128 per 100,000, and Latinos at 78 per 100,000. And the only groups that are below that average are white and Asian. And we know that there's a lot that's not told by this data. Asian needs to be disaggregated into different groups. Some of these groups, it looks different when you start to separate it out by age groups, where we start to see it looking even more severe than what we see here. But bottom line is that there's no question that COVID-19 itself is disproportionately impacting communities of color. And you can see it right here in Alameda County with a very disproportionate death rate. When we look nationwide, we are seeing a very similar trend where Black and Latino persons are disproportionately represented among COVID deaths nationwide. So, a bigger percentage of the deaths compared to the population for both Black and Latino groups. And now I want to show you what is going on with new cases of COVID-19. And here you can see the yellow line is showing African American cases. And you can see the line looking kind of middle of the road, pretty average this entire time for this entire pandemic until now. Around this April time frame, you see that the yellow line crosses over, and you see the direction it's heading straight up. These are new cases by race. And you can see here that we have a widening, and you can see the Latino line is bumping up just a bit as well. And but that the line that the new cases for African Americans is going straight up in the wrong direction. These lines will probably never meet again. Why? Because there are disparities in the vaccination rate. So now you have increasing cases among African Americans, a extremely disparate death rate among African Americans. So, in my estimation, anyone who's thinking and reasonable and can do basic math could see that if the goal was to reduce the Black population or the Latino population or even other communities of color, the best thing to do would be let things take their natural course. Just like Tuskegee. You had syphilis, you had the cure, you withheld the cure, you let it take its natural course to begin to exterminate or allow the extermination of a race. That is what you would do in this situation if you wanted to see more Black people die. Let COVID keep doing what it does. Let people keep not taking life-saving intervention, and that will be the result. It's very plain and simple. I think all the data shows it, and that would be the way to go if that was the intent. Nonetheless, I think it is very tempting for people to believe what is a lot of misinformation and disinformation out there right now. And there's a variety of reasons for this. And one of the things I hear is, why are they trying so hard? Why did we have all these performances right from the beginning? You all may remember this nurse who was one of the first people we saw flashed up there receiving the vaccine. Some of our political leaders here being shown. And from the first day I saw these, I said, this is just going to raise skepticism. Those of us on the ground were all really shaking our heads with this. Because, of course, this is going to raise skepticism, because when have they ever tried this hard before? They haven't. And so, of course, this made people very skeptical and very concerned. Why are they trying to sell this directly to me? And I believe that this is some of the reason for some of these current concerns. Then they started having lotteries. When I first saw the Vax for the Win here in California, I knew clearly this was going to raise skepticism in our community. First, it was free. That was bad enough because nothing is free, especially not here in the United States, especially not when it relates to healthcare. We know that you could go to the hospital injured, and typically the first question is going to be who's paying for it. So that's what we're used to. So having it come free was a reason enough to be a little skeptical. But then when they started giving out money and doing lotteries, then that really raised an eyebrow among a lot of people, asking why, again, why are they trying so hard? But remember, this tactic of using these lotteries is being employed everywhere, all across the country, including this here giveaway in West Virginia to give away rifles. So clearly, this is targeting a different demographic. And so, why all of this? So, I'm going to show you one of the polls that was done by Kaiser Family Foundation, who's been doing a great job at putting out some of these polls. And this was from back in January. So when the vaccine really wasn't widely available quite yet. But you can see here with these dark bars on the left, those are the people that have already gotten it or plan to get it as soon as possible. And you can see here that the white population was the first out of the gate, ready to get the vaccine. And you can see here that the least prepared to go get it right away was the black population in terms of the race ethnicity piece, and then on the political piece was Republicans. And so I think it's pretty simple that what happened is that policymakers and leaders and others looked at this and said, if we want to get folks to get vaccinated, those are the groups that we are going to have to worry about. And it's a little odd that these are the two groups that are having the lowest vaccination uptake rate. For, I think, is for very different reasons, but nonetheless, this is simply governments are good at doing polls. They do polls and then they react. And I think it's really just as simple as that. I don't think it's a whole lot more sophisticated or the way that it's trying to be made out to be as some kind of great grand plan. I don't think we're that sophisticated. I don't think we're that coordinated. I don't think that we have that many nefarious people in all the necessary places to pull something off, like some kind of plan for genocide. I think plain and simply, they want to end the pandemic like we all do. They made an attempt to try to reach out to the groups that appear to be least likely to get the vaccine and help us end the pandemic. They know, like I know, like I think most people know, unfortunately, the only way we get out of this pandemic is the vaccine. Wish there was another way. If y'all know another way, please by all means share it with me. Send it to me. I'd like to know how we get out of this pandemic without the vaccine. We tried a lot of things for a lot of months, and none of it was coming close to working. And now that we have the vaccine, we see that we can have things head in the right direction, but we also understand how it works. We have to get to the threshold needed to stop the spread, and we're not at that threshold. And unfortunately, it is a moving target. Why? Because the virus mutates. It does what it does, and it's doing what it does better than we're doing what we're supposed to do. So it's staying a step ahead of us. And now that we have a more contagious variant, it means that our threshold required for herd immunity is going to likely need to be higher. And so it is a moving target in that sense. And so, if anything, we need to be speeding up to try to meet that demand. And instead, we have leveled off at a level that is concerning, that we won't be able to get ahead of this and that we won't be able to get out of this pandemic. And that is very, very concerning, because I know that we are all tired of this and we would like to put this chapter behind us. But we are just not there yet. And so I think that the government, the decision makers, the people making all these campaigns and performances and lotteries and all of that, I think all have the intention of ending the pandemic, like I think we all do, of getting the economy back on track. And unfortunately, the way they rolled out the campaign oftentimes was botched. It was confusing, and it did not work well for groups that they have alienated a long time ago. But it still doesn't change the fact that we need to do the best thing that we need to do for our own health and our own safety and that of our family and our community. And that means really trying to be logical about this and not take the fact that we know there's reasons for mistrust. We understand that, but don't allow that to make you susceptible to being indoctrinated. Frankly, I hate to use that word, but the way that some of these conversations are happening, and I'm trying to have these conversations with folks. So if anyone's ready to really have this conversation, please let's have the dialogue. I want to understand how can this be a tool for genocide to eliminate communities of color, people of color, when the main people getting it are white and their death rate is going down and their case rate is going down and other groups are going up. How does this make sense? So I've been trying to think this through. Maybe one way this can make sense is that when you show up to the vaccination site, there's different vaccines for different people. And I think that this would require an awful lot of coordination and I mean that is a serious conspiracy. I just don't even think that we have the wherewithal to do it, to execute on anything like this, nor the will, nor the desire. We have so many smart people in our community, so many dedicated people that are working together to really come up with and understand the best science, the best advice to give our community. I know I meet with my colleagues on an incredibly regular basis, more than I ever have before, to make sure that we are putting forward the best information and the best advice. And so I find it very hard to believe that there could be such a plan. And remember, the vaccines come in multi-dose vials. That means that there are like 10 doses, and the amount varies a little bit based on which vaccine. But it's not that there's a single vaccine in a single vial. There are multiple doses there. So if you're in line with 10 people, then you're all getting a vaccine out of the same vial, basically. So I don't know if you're really worried that they're giving it different vaccines to different races. Maybe get behind a white person in line. I mean, it's really, it doesn't make any sense, but I'm here to tell you that there's no way that you could get a different vaccine from another person. It just doesn't make any logical sense. So the only other explanation for how this could be targeted towards a certain race would be if you believe that there is some kind of sophisticated way in which this vaccine targets a particular race. Again, if you have data, if you have information, please just put it forward. Let's get it on the table. Let's talk it out. Because otherwise, it really doesn't make any sense and it's sounding like indoctrination. And I really hate to see that because at this point in time, we are in a situation where cases are rising, the death rate is high, the vaccination rates are low. The whole entire recipe is for one of increased disparity, more death, and more devastation within our community. So please, let's be as logical as we can and use the minds that we have, the brilliant, great minds that we have, and really dissect this out. And as I've said, I'm here for the conversation. I'm here for any evidence that you have to provide. And really, the threshold of the quality of evidence is going to be high. And you have a lot of smart people in the community that are ready to have those conversations. So if that's what's needed, then let's do it. So remember that we need multiple layers. And I'm going to say this, that people who are vaccinated, don't be part of the problem. Don't go out cavalier without your mask on and potentially be a person who catches COVID and potentially gives it to someone who is unvaccinated, which includes children. It could also include people who haven't gotten vaccinated yet, but it can also include people who are vulnerable because they may not have mounted an adequate response to the vaccine. And there will be more recommendations coming forward for this group of people very soon. They're already evaluating the data and whether the recommendations need to change a bit. And so for now, we need for everyone to be vigilant and responsible and not be part of the problem because once again, we are not at herd immunity yet. It is just not time to relax and let down our guards. We need multiple layers of protection. This is one of my favorite models that was put forward by Ian McKay, who is a virologist from Australia. And this is the Swiss cheese model, which shows that none of our layers of protection, even the vaccine, none of our layers of protection are perfect. The vaccine is pretty phenomenal in terms of its success rate, but all by itself is not enough. We need all the other different layers, and so that may include your masks, it includes not touching your face, it includes washing your hands, it includes ventilation and good filtration, and it includes getting tested, isolation, and quarantine if you have symptoms. So please take good care of yourself, get good nutrition, physical activity, take a multivitamin and additional vitamin D supplements, get a good night's sleep, manage your stress, and take care to get screened and monitored for any chronic health conditions. That concludes today's People's Health Briefing. Thank you for joining us. We'll see you next Tuesday.